When you were diagnosed with cancer, did you feel like your world had been flipped upside down, learning a foreign language? Local therapy, systemic therapy, cytostatic therapy, cytotoxic therapy, immunotherapy, targeted therapy, biological therapy, hormonal therapy. It's enough to knock you off your feet. I'm cancer physical therapy specialist, Dr. Leslie Waltke. Let's go into the recovery room to learn more about these cancer terms, and let's get us back on our feet. Let's begin by defining the two broadest cancer treatment categories. They are local therapies and systemic therapies. Local therapies are cancer treatments that treat either where the cancer is or where the cancer was. Local therapies include both surgery and radiation. Systemic therapies, on the other hand, treat the entire body or the entire system. Systemic therapy drugs are usually given orally or by IV. Now let's break down systemic therapies into subcategories. Systemic treatments can be cytotoxic or cytostatic. Cytotoxic means to kill cells, so most traditional chemotherapy drugs are cytotoxic. They are designed to kill rapidly dividing cells. Now, unfortunately, they also kill cells of our bloodstream, hair follicles, and gastrointestinal tract. Cytostatic drugs, on the other hand, are substances that manipulate the environment in which a cancer cell may live, making it more difficult for it to survive or grow. It doesn't kill it, it just makes it harder for it to live. Now, drugs that attack specific types of cancer cells in specific ways with less harm to normal cells are called targeted therapies. Immunotherapy is a targeted therapy, and they can be either cytotoxic or cytostatic. Immunotherapies manipulate the immune system to help kill or limit the growth of cancer cells. Common examples of cytostatic targeted therapy drugs include Avastin, which limits a tuber's ability to grow more blood supply, and Herceptin, which is a drug that limits signaling inside the cells of HER2-positive breast cancers. Then finally, there are hormonal therapies. Some cancers, like breast and prostate, use the body's natural hormones, like estrogen and testosterone, to grow and divide. In these cases, anti-hormonal therapy drugs are used, whether it's androgen deprivation therapy in men with prostate cancer or anti-estrogen treatment in persons with breast cancer. Now, please note, targeted hormonal immunotherapy, cytostatic treatments may have fewer side effects than traditional chemotherapies, but they still can cause significant life-altering side effects. So if you are struggling with fatigue, weakness, or other physical problems resulting from any local or systemic therapy, talk with your cancer doctor or nurse about getting you to a physical therapist. I'm Dr. Leslie Waltke, signing out from the recovery room. May your feet be solidly planted on the ground. Let's talk again soon. When you were diagnosed with cancer, did you feel like your world had been flipped upside down, learning a foreign language? Targeted therapy, hormonal therapy, biological therapy, systemic therapy, cytostatic therapy. Start over again. Sorry. It's really hard to do. Is the button still on?
Yep.
Okay. When you were diagnosed with cancer, did you feel like your world had been flipped upside down, learning a foreign language? Targeted therapy.
Okay.
When you were diagnosed with cancer,
Sorry.
blooper reel, blooper reel. Okay, try that again. Oh my God. Whew, okay. When you were diagnosed with cancer, Connie! Okay, hurry quick. I got too much blood rushing to my head.